Up first this evening, from COVID-19 to monkeypox, there are now confirmed cases in the United States, Canada, and in at least 4 countries in Europe, including the United Kingdom. So what is monkeypox, and should we be concerned here in Jamaica? I'm joined by public health specialist Dr. Orville Nemhard via Zoom. Dr. Nemhard, thanks for joining us.
Thank you, Herman. My pleasure to be here.
All right, good. All right, this is not something we have heard about in recent years, so let's start with the basics. What is monkeypox?
Well, monkeypox is the name of a viral infection which is caused by the monkeypox virus. Now, this virus is actually similar to smallpox, and it manifests in pretty much the same way as smallpox, whereby you get these lesions on the skin. It is spread by close contact, respiratory spread, and skin-to-skin contact, particularly if there's breach of skin, spread by way of the mucous membranes. And it will take anywhere between 5 and 21 days for you to develop symptoms. That's the incubation period. On average, it's more like 7 to 14 days for you to develop symptoms.
All right, the images we are seeing here now basically looks like a full outbreak of the disease. What are the signs and symptoms that you would see in these 14 days?
Right. So it will begin with the usual signs of a viral infection: fever, headache, malaise. And then you get a skin rash, which progresses over time. It starts out as like a flat lesion, and then it becomes a little more raised, and then it will form pustules, that is little waterhead bumps. And then over time, which may be anywhere from that 2 to 3 weeks, it may dry down, leave scars on the skin.
All right, can it be prevented?
Well, spread is airborne and droplet. So the same sort of prevention mechanisms which we've been using for COVID would apply. The question, of course, is why are we seeing this now? And I'm not sure that there's an explanation why we're seeing the spread. And the other issue, well, because it's not new, as opposed to something like COVID, we do have a record and some history of how to manage it. So persons who got smallpox vaccine in the past would have some immunity. There is a monkeypox vaccine available, registered in the States. And in addition, there is some experience with the use of some antivirals with the monkeypox disease.
Okay, well, are we at risk here in Jamaica of actually getting cases, confirmed cases overseas? How much at risk are we?
Hard to say. The reality of why we're seeing the outbreak now across Europe and into the US is unknown. So what are the factors that are driving this? We really don't know. Once it is that we're dealing with an infectious disease of this nature, meaning airborne spread, then it is certainly within the realm of possibility that we can see cases being imported across the world in the same way that we saw COVID spreading across the world. I mean, nobody's speaking of a pandemic of this at this point, but the spread across borders is certainly within the realm of possibility.
All right, based on your knowledge of the disease, what should we, as the population, do, and probably even at our borders, what should we be considering now to prevent the virus coming here?
Well, clearly persons who have the skin lesions, we would not be looking to admit them, or we'd be isolating them on presentation. But the incubation period goes up to 21 days. So somebody can come in perfectly well and get ill up to 20 days after, during which time they may be infectious. So there's no way that we can guarantee that it won't cross our borders in someone who is asymptomatic at the time when they enter the island.
Okay, good. So basically, be on the lookout for it, and you say it is transmitted just as the COVID virus is the COVID-19
yes,
virus
airborne spread
is transmitted.
And very close contact.
Okay, good. All right, thank you very much, Dr. Orville Nemhard, public health specialist, with details there on the monkey virus.